Hi guys, Dr. Vera Salvatore here at Salvatore Dental. And today we're gonna take a few topics about oral health and how it affects the rest of our body. You know guys, the thing is our mouth is connected to the rest of the body. We're not separate, we're all connected. And there is a communication system that we can call it blood vessels and blood that transports whatever's happening in the mouth to the rest of the body, the rest of the organs. And let's say if in the mouth we have gum disease or we have bone disease, that inflammation, those bacteria entities are going to travel through the blood and go to the heart, let's say. And if they go to the heart, they're going to create a party there. They're going to create a colony and plaque will build up, which can result in many issues, heart disease, heart attacks, strokes, and whatnot. So it is imperative that whatever's happening in the mouth is handled so that nothing goes down to the heart and cause bigger issues. Diabetes is an interesting topic because sugar levels in the blood can affect what's happening in the mouth and vice versa. What's happening in the mouth can affect how our diabetes management is handled. So it is very important to have a good grasp and control over both areas. But let's say if in the mouth we have cavities, we have gum disease, we have bone disease, the inflammation in the mouth will result in the control of the sugar levels being uncontrollable. And diabetes, unfortunately, will not get any better. It's just going to get worse. It'll be harder to control infections in the mouth. And vice versa. If the diabetes is not controlled, certain dental procedures may be difficult to achieve and to get a good result. For example, surgery, implant placement. If diabetes is out of control, implants may not heal so well with the bone and thus may not last in the mouth. So diabetes, oral health, they go hand in hand. They both have to be managed from both aspects in order for us not to have any problems. Everything that's happening in the mother's mouth is traveling through the bloodstream to the baby that's in the belly. And if the mother has gum disease, bone disease, we have cavities, things that are happening there, the baby is susceptible to those same conditions. Gum disease and anything that's traveling to the baby, we want to prevent. We want that baby to develop nice and healthy. It's very easy to do. All the mother has to do is do good oral hygiene at home. We're brushing, we're flossing, we're rinsing. We're seeing a dentist regularly. So if there are issues, we can take care of them. And we can prevent any of those toxins from going down to the baby. Whenever we see a new patient in our office or a regular patient that comes in, we always check the tongue, the mucosa, the gums, what's happening around, especially with smokers, because people are predisposed to oral cancer when they smoke. Again, we're dealing with bacteria, we're dealing with inflammation, we're dealing with toxins that are not good for the body. And all those elements do contribute to things like pancreatic cancer, problems with the gut. Even there's a link between breast cancer, there's a link with heart disease, how oral health affects diabetes. So there's such a big connection, and it's so easy to prevent multiple diseases and cancer factors when we just take care of the mouth. Well, let's think of the immune system as the strong armor, the jacket that protects our body. If the jacket is weakened with things that are happening in the mouth, cavities, gum disease, bone disease, that jacket is no longer able to protect the person. If the person, let's say, gets a simple flu, right? All those soldiers that are supposed to protect the body, instead of now tackling the simple flu, now they have to go to the mouth and defeat the bacteria that's happening there and fight the inflammation and all the germs. We're weakening that shield, which really there's no reason to. because it's so simple. Simple prevention. You know, it all starts with good hygiene, good brushing, good flossing, good rinsing, routine checkups. If there is a problem, it can be handled, and it can all be maintained so that immune system of ours, that shield that we all have, stays strong and is able to defend other infections. Awesome, guys. So if you have any additional questions, or if you just want to get a checkup, we're here for you. We're here to help. You can call us at 518-899-6068, and we'll be happy to take care of you.